My sister works at Children's Hospital LA, kept telling me you need to come to Children's Hospital LA, which now is at least a 2-hour drive from my home. So we settled on a female gastroenterologist, pediatric specialist. Again, I thought she had a good bedside manner. I wasn't real unhappy with her for any of that reason. She said the same exact thing again. She started with the constipation again. That was her first diagnosis. You know, my heart started just hurting again because I thought, you know, once they just immediately, without, they sort of look at the history and they sort of do a little physical, but just an immediate, that's what it is. I thought, she's going to close her mind real quickly. Just a one doctor, 1 5-minute, looking at my daughter. I thought, oh, God, please keep an open mind. Please don't. I would say we saw her 2 times, and she recommended the pain clinic there, which I was all for. We waited, and we got in, and it was a man and a woman, like a therapist and the main pain doctor, and they interviewed me and Hayley together, and then Hayley alone for... They interviewed Hayley alone for maybe 15 minutes, but they interviewed me for like 45 minutes. And it's just the whole gist of it that instantaneously felt very much like they had made up their mind that I'll tell you what I felt like. Very persecuted. It was very much that I was... had just decided that my child was sick, but that she wasn't, and that my child needed therapy. I had brought up the POTS thing. By this time, I had found Dr. Fisher by myself on the internet and had looked up this POTS that I figured out that I thought my daughter had. And so I brought this up to the pain doctor and I said, look, I have found this disorder online that it sounds like my daughter has. It fits her symptoms to a T. And I said, do you think it's possible my daughter has this disorder called POTS? And he says, oh, absolutely not. That's, that's a throwaway thing. There's no validity to that. And he just poo-pooed it. And my sister looked over at him and she said, really? I mean, really? Because it absolutely sounds like my niece has all of those symptoms. And this is a Mayo Clinic doctor, and and he's just like, oh no, absolutely not. And they couldn't give her the therapy that she needed because they were too full of pain, real pain patients, is kind of how he was saying it. And because of where we lived, it would be too hard. So I needed to find, this is what he told me, I needed to find a counselor on my own who dealt with adolescents who were in pain in my area. That was it. And he just sent me away. I said, I'm going to look into this Mayo Clinic doctor that I found online. And then that's what I did. What a fluke. What a fluke that I found this. And so I'm reading more about Dr. Fisher. And it really is a disorder or a disease, and it really can be managed with some diet and exercise and lifestyle changes. And I thought, oh, thank you, thank you, thank you. And I was so happy because at the end of it, it said, there was a phone number. And it was like, if you have any questions about this doctor or your daughter or child's diagnosis or symptoms, call my office. And I thought, you've got to be kidding me. Seriously, there's just a phone number to a doctor at the Mayo Clinic. And I'm thinking, it's going to be the same thing. I'm going to call and they're going to say, we can't help you. Or I'm going to call and they're going to say, come in a year. But of course the Mayo Clinic's far away, but at this point I'm thinking, I don't care. I'll go anywhere. I called the number, and that was a really happy day. I said to the lady on the other end, and it was his nurse, I assume, and I said, hi, I just found your number on a website, and this POTS thing sounds exactly like what my daughter has. I'm just referring myself. I just want to know, how would I get my daughter help from this Dr. Fisher?